It's time for Back to Life, brought to you by Southwest Spine and Pain. A 30-minute conversation with their board-certified physicians about how to live life again, pain-free.
Welcome to Southwest Spine and Pain Back to Life show. Our host today for the next 25 minutes is Dr. Jared Dupre. And he's going to be discussing integrated pain management.
That's right. Happy to be here.
Oh, so glad you're here. Let's talk about that. What does that mean when you talk about integrated pain management?
So integrated management in general in healthcare is the idea that we need to integrate different aspects of not just how we treat, but also different professionals and work together to treat whatever's going on with the patient. It's much more collaborative. It's also much more effective. We also find that the research shows the physicians are much more satisfied in doing what they do as well as the patients. So it's a much more effective way to treat healthcare in general, especially pain.
And Dr. Dupre, can you give us an example of how you've done that, or I know there's a lot of different aspects of this and different functions, but can you kind of walk us through the steps?
Yeah, typically we have an actual separate location in St. George called Southwest Healing and Wellness. It's a sister site to our Southwest Spine and Pain clinics, and that's where we actually engage in the integrated care specifically. And typically what happens is we engage in a full evaluation. So when we evaluate, we're looking traditionally at the pain condition and the various physical aspects that contribute to that. But in addition to that, we're looking at fitness, nutrition. We're looking at emotional health, mental health. We're looking at the relationships. We're even looking at things like career, finances, all these pieces of our lives that impact us. And I don't know, surprisingly or not to some of you, but all contribute to our pain. And then as we evaluate, we customize a plan based on all the professionals and resources that we have there. So we have a team of professionals and a team of various services that go outside the traditional approach of pain management. And every person's different, obviously. And so that plan may lead to doing some oxygen therapy to help the fibromyalgia, which is in a hyperbaric chamber. We have a Qigong class in the back there. We have a full Pilates yoga-looking type of room where we have instructors that specialize specifically in pain that can help them go through the movement that they might not be able to at a typical gym. They may engage in either counseling or wellness coaching to look at their life balance and look at their eating habits and their fitness plans. We may bring in a physical therapist or fitness specialist to help them work through a plan that helps them actually get the fitness that they need while considering the pain conditions that they have. We may do amino acid therapy, which is something I'd like to talk about today at some point, which is kind of a unique way to nutrate the brain to address things like energy and focus and mood and pain. But all those things we do is customize based on the person, and as we treat, we follow up, obviously, and adjust, and we find that once again...
It's time for Back to Life, brought to you by Southwest Spine and Pain. A 30-minute conversation with their board-certified physicians about how to live life again, pain-free.
Welcome to Southwest Spine and Pain Back to Life show. Our host today for the next 20 minutes is Dr. Rick O'Bray. He's going to be discussing stem cell.
Thank you.
Rick, take it away.
It's good to be back. I'm happy to be here and discussing stem cell therapy. A little background on myself. I am Dr. Rick O'Bray. I work with Southwest Spine and Pain. I'm an interventional radiologist and pain specialist. And we've been working with stem cell therapies now for about 6 years and have been involved in several national research trials involved in that. One of those trials has been a trial looking at degenerative disc disease and actually using stem cells from donors, cultured stem cells, to treat those patients. And I want to talk a little bit about kind of common questions that I receive talking to patients about stem cell therapy. And probably one of the most common questions I receive is, what are the risks of stem cell therapy? What do patients need to worry about when they're considering undergoing this therapy? And probably one of the biggest concerns that I get with risks has to do with, are these going to hurt me? Are these injections potentially going to hurt me? And the question I give is it depends. It depends on the type of stem cell therapy that you're having, where the source of stem cells are, and the experience of the provider who's actually doing those injections. And there are many different companies out there that produce stem cells now. Back in the early days, there were probably one or two that I noticed, and it seems like just about every week there's a new company that's quote-unquote offering stem cell therapy. Not just companies providing the cells, but also some of the providers that are doing some of these types of injections. So let's address that a little bit, just from an educational standpoint, so patients understand. So there are three major ways that stem cells can be administered in the United States right now, outside of a randomized FDA-approved trial. So what are those means and ways that you can receive these types of therapies? Well, the first is autologous bone marrow stem cell procedures. And this is probably one that where we have the most experience and most evidence in as a medical field. And the reason for this is these types of stem cell procedures have been done in Europe for many years, and particularly France. As a physician in France, a little orthopedic surgeon, that has been doing bone marrow aspirate type procedures for over 10 years now. His name is Philippe Hernigo, if you're ever interested in looking at some of his research. But basically what happens with these procedures is you take a needle, you advance it into the bone marrow, and then you aspirate bone marrow, and then you take that bone marrow and you inject it into an area of pain. So commonly that's done in the knee. So someone will come in, will take a small needle, will numb the hip or the ilium, will advance the needle in and aspirate bone marrow, and then inject that into the knee. And that can be done either intra-articularly, or it's in the joint itself, or underneath the cartilage in a subchondral location. And so what are the risks associated with that? Well, primarily the risks associated with that type of procedure are risk of bleeding. Anytime you put a needle in the skin, there's a risk of bleeding. There's also a risk of infection or nerve injury. Now, assuming that someone knows what they're doing, those risks are relatively minimal. And having done numerous bone marrow aspiration procedures, those risks should be pretty minimal. And it's not particularly a painful procedure either if it's done by someone with experience. But the risks are primarily bleeding, nerve injury, or infection from that procedure, and then assuming that you can get it in the right place. So that's relatively safe. Again, that's relatively safe for someone who's done 10,000 or so procedures. For someone who's trying to do that for the first time, accessing that iliac bone or accessing the bone marrow in general can be very dangerous. So that's generally something that's reserved for people who are very experienced. And I see that less frequently with some of the new quote-unquote providers that are providing stem cell therapy, just because the level of experience required to do that procedure is pretty significant. More commonly, what I see with stem cell procedures are what are called tissue allograft procedures. And those are the umbilical or placenta cord or placenta tissue procedures that we hear about. One of the more common things that I see is advertising for autologous blood injections or autologous blood stem cell injections. What does that mean? Well, it depends. So it turns out that most of the research in using musculoskeletal applications is focused on a particular type of stem cell called the MSC or mesenchymal stem cell. Well, why does that matter? Well, the mesenchymal stem cell has been shown to have what we believe are anti-inflammatory properties and regenerative properties, not just in the musculoskeletal system, but in also treating conditions like autism and multiple sclerosis. Well, if someone is getting a cord blood injection, why does that matter? Well, it matters because the primary stem cell in cord blood is not the mesenchymal stem cell. The primary cell in cord blood is actually a hemophilic stem cell. So those stem cells have not been shown with research to have a significant impact on the musculoskeletal system or anti-inflammatory properties. Those stem cells are the primary cells that develop many of your red blood cells and some of the blood elements. So they can't develop into cartilage, they can't develop into muscle or tissues that develop in the musculoskeletal system. So that's a key point that I don't know that a lot of people understand. And I bring this up because I was at a conference recently, and there was a vendor for a company that was advertising that they do cord blood stem cell injections. And I was very curious. It was a physician that was no longer practicing, but he was selling product for this company. And I asked him, I said, well, do you have stem cells in your product? He's like, of course we have stem cells. We have millions of stem cells. And I said, well, are you aware what kind of stem cells that you're injecting? He's like, not really. I'm like, well, you should do a little research, because the stem cells that are present in cord blood are the hematophilic or hematopoietic stem cells, not the mesenchymal stromal cell, which is the one that most of the research suggests is very effective. And then, within a week, he was no longer selling for that company, which I thought was interesting.
I wonder why.
Yeah, exactly. So there's a lot of language in this space. And again, the regenerative medicine space, particularly stem cell space, is changing dramatically almost month to month as more research comes out and more evidence comes out. And that's what we want, right? Because we're still in the early phases of this technology. I saw a study recently looking at multiple sclerosis and using stem cells to treat multiple sclerosis. And what the study demonstrated was, over a 2-year period, when patients received intravenous injection of high-dose mesenchymal stem cells, their recurrence with MS dropped from 90% or from 60% down to 6%, which was pretty dramatic. I have a father who suffers from multiple sclerosis. That's something that I'm very interested in. So there is research that's coming out regularly. There are several phase 2 studies done at Duke University looking at using stem cells to treat autism that have been very positive. So where the spectrum of autism in Utah is about 1 in 62 patients, children will develop autism. That study was something we're watching very closely.
That seems to be increasing, from what I understand, autism in young children.
Yeah, we're not sure why that is. I mean, what is it about that? And there's been some suggestions out there about different types of causes, but this was one of the first studies I've seen that had any real significant potential benefit in treatment for autism. And about 4 weeks ago now, I was down in Panama City, Panama, speaking with a researcher who's done significant research on intravenous injections of stem cells. And 2 of the patient populations he's treated were multiple sclerosis and autism. And he had some very interesting research looking at autism as well as multiple sclerosis. So those things are coming. One of the things I think is very interesting that people should be considering, and having 3 children myself, it's something that I wish I had considered, was storing their umbilical cord blood and stem cells from pregnancy. So if you have a child and that you give birth to that child, usually that umbilical cord and placental tissue is discarded. Now, it makes sense that the body, with nature, there's a tremendous amount of effort that goes into making sure that baby's healthy. And that placenta and that umbilical cord is really focused on doing that. So usually that's discarded, but there's a tremendous number of stem cells in that umbilical cord, as well as the placenta, as well as a lot of different growth factors and cytokines that are very anti-inflammatory and pro-healing. So there's several companies looking at utilizing the cord blood and the stem cells, not just within the cord blood, but also within the Wharton's jelly, which is rich in the mesenchymal stem cells, and storing those. So throughout life, if anything ever happened to a child, for instance, say they unfortunately develop autism, they would have those cord blood cells that could be used.
Can you store that well?
You can. So it requires that is well studied. And traditionally, the problem with storing stem cells has been very cost prohibitive. So usually there can be anywhere from $3,000 to $5,000 to store the umbilical cord and cells for a child. Those prices have come down recently, and I've been working with a company and actually co-founded a company that looks at storing umbilical cord blood and Wharton's jelly stem cells for moms and babies for about $200 a year, which is pretty dramatically different. And the reason we do that is by automating some of the ways that can be done. But that's promising, and the hope is that one of the things that was interesting about the Duke study is they used stem cells from babies' cords that had been staved. So to qualify for that autism study, they had to have saved their cord blood and cord blood stem cells in order to qualify for that study. So parents who had not done that, those children for that study were not eligible to participate in that autism study. So
were there quite a few that
qualified? Very few. Unfortunately, very few patients, pregnant moms, have done cord blood storage. Well, because of the cost. I mean, $5,000. That's hard, particularly in the past. It's hard to spend that kind of money for moms and young families. I mean, that's cost prohibitive. So I can understand why they would not have done that. So very few had done that in the past. However, with some of the evidence that's coming out, particularly with autism and then multiple sclerosis, a lot of inflammatory conditions, I think that will change. And one of the reasons we looked at starting this company called CellSure was to allow families ability to do that for just about cost. $200 is very close to cost of storing cells, because those cells have to be procured and they have to be saved in a very particular way to keep them viable, and then they have to be stored at 200 degrees below zero. And we're looking at ways to maybe fix that so they don't have to be stored, and that has to be done in liquid nitrogen all the time. Otherwise, the cells are not viable.
Boy, what a guarantee you'd have to have on something like that, wouldn't it?
Yeah, it's a
For
pretty
the hope
tricky.
of the future.
But exactly. The hope is that you save a reservoir of cells that only occur within the first 9 months of life, that are really important in development protection of a developing baby. And once they're gone, they're gone. When we try to take mature stem cells from an adult, those cells are very different than the cells that we get from the umbilical cord and Wharton's jelly. So it's hard to predict what the future is going to be, but I predict that reservoir of cells that occur very early in life are going to be critical for treating diseases throughout life. And it's not just going to be multiple sclerosis and autism. It's going to be autism when you're young. It's going to be maybe it's scoliosis or spina bifida. Mm-hmm. Maybe in your 20s and 30s, maybe it's preventing degenerative disc disease and disc herniations. And then in your 40s, as I'm experiencing now, it's protecting your knees so they don't wear out. Right. And then as you age in your 50s and 60s and 70s, maybe it's Alzheimer's disease and preventing dementia. So I predict these cells will have a dramatic impact on treating us throughout our lives, and whether it's stem cells from the cord
to preserve our health and good health.
Yeah, it's hard to predict the future, but just from the research that I've seen, this is an area that I've studied extensively, that the nature of these cells is so profound that they'll be just, it's going to impact every area of medicine. It's going to impact how we treat cancer. It's going to impact how we treat inflammatory conditions, everything from rheumatoid arthritis to things like multiple sclerosis. And I think it's going to have a major impact on degenerative conditions like osteoarthritis of the knee, shoulder, rotator cuff tears, all that kind of stuff. Again, this is in the infancy, so this whole field is developing very quickly. But I saw research very recently where they were using high-dose stem cells to treat transplant patients. So one of the problems that happens with transplants is that the body's immune system of the person receiving the transplant attacks the organs that are transplanted into them, say a kidney. So they receive a kidney and then their body rejects it and they attack it. Well, some early research I saw that if you actually infuse high doses of stem cells, you can limit the rejection of the recipient kidney. So you can actually decrease or slow or stop the rejection of that.
The rejection,
which
that's
is
pretty amazing.
Pretty profound when you think about that, because that can be devastating when you are on a transplant. You used to wait, and then all of a sudden your body rejects the tissue. To have a way to ensure that we can do that is pretty profound.
Could we stop for just a minute,
Sure.
Dr. Rick, and just let everyone know that might have just stayed tuned to the program that we're talking with Dr. Rick O'Bray with Southwest Spine and Pain Back to Life show. And he's discussing stem cell products and research. Is that correct in saying that?
Yeah, that's correct.
Okay.
And part of the reasons that we do the show is mostly to provide education for patients and people who would be interested in the technology. There's so much information out there, and it seems to be increasing from a variety of sources. We feel obligated to try to make sure we educate the public about what to look for if you're considering these types of therapies and what the future looks like. Mm-hmm. Go ahead.
I was just going to ask, can you give, so that the listeners that might be listening to this, can you give some experiences or examples of some of your patients where you have had successful procedures done in their behalf, that you've been the one that's been providing that service to them, and what was their condition? I don't mean to take you away from
Sure.
what your ideas or thoughts you're sharing, but I wondered if that might interest them as well.
No, that's a great question. I think as a practicing physician in spine and pain for almost 10 years now, one of the biggest frustrations I have is what happens when you have the patient and you exhaust all the normal treatment options for them. So, for instance, have patients that have very bad osteoarthritis in their joints, in their hands. I have a patient in mind that has very bad osteoarthritis in their hands, and they've tried everything to treat that. They tried medications, they tried anti-inflammatories, Aleve, ibuprofen, everything, and nothing seems to work. And they get to a point where they're almost desperate because they can't use their hands. Yeah. So if they want to go out in the shop or they want to do anything, we use our hands to do that, and it can be very painful.
Pick up things.
Yeah, something as simple as picking up a glass or drinking a soda becomes very difficult because that requires being able to use the hand to do that. And for a lot of these patients, we will do injections into the joints directly. So we use cortisone. Cortisone is a medicine we used many, many years, decades in medicine, as an anti-inflammatory. JFK had cortisone injections in his spine for many, many years. And cortisone works very well, but it hurts to inject sometimes, and it lasts for about 2 to 3 months generally, especially if it's a chronic inflammatory condition. So I've had patients who come in that had pretty significant arthritis in their hands, and very early on, we thought, well, what are other options? And that's really got what me involved in stem cell therapy, is providing hope for patients that have kind of exhausted the normal treatments. And one patient in particular had very severe arthritis in their hands, and we injected stem cells into the hands, and did very well. Got to the point where they were functional, probably a series of injections, probably 60% from the first one and up to 80% from subsequent injections. Now, this is a very early stem cell therapy that we're doing, and the research, there's not much research for injecting stem cells at this point into the small joints of the hands with osteoarthritis. So in some ways it is pretty groundbreaking, but the patient was aware of the risks and they're comfortable with that, and it really exhausted all alternative therapies. And at that point, they're doing very well from those procedures. I mean,
when you did that, was that what kind of stem cell did you inject in him?
Yeah, for that one we used a tissue allograft injection, which is an umbilical cord product. Yes. And the reason we used an umbilical cord product in his case was that joints in the hands are very small, and when we use bone marrow aspirate, generally it's hard to get very high numbers of stem cells because as patients age, you just don't have a lot of those bone marrow stem cells. So we used a concentrated umbilical cord product and that's the reason we did that, is we were trying to get as many quote-unquote stem cells in there as we could. And the results have been very, very interesting at this point. I've been very encouraged with what we've seen so far. And maybe we can have him on the radio at some point.
That would be great.
He'd be happy to do that, to talk about his experience.
And now we're down to just 3 minutes. Would you like, we're just down to 2, Jeremy's saying. So what would you like our listeners to understand during these last 2 minutes?
Yeah, here's what I would say. I would say stem cell therapy is a promising therapy that has tremendous upside. But like with every therapy, there are positives and there are negatives. And it really, at this point, because the research isn't there yet, it's really important for patients to be educated about what they're receiving, what the potential benefits are, but also what the risks are. So it's really important to do your homework. Generally, these procedures are cash pay procedures, and I've had patients come from all over the country that we've treated. And some patients were being charged $20,000 to $30,000 for some of these procedures. Now, outside of a situation potentially in Panama or Grand Cayman, where there are some procedures that are very expensive, and there's probably merit to what's being done there, that's absurd. I'm just going to tell you that's absurd to have those kind of costs associated with this. So probably the biggest thing is I would say patients, talk to your physicians, talk to your treating physicians, and make sure they understand what you're doing. They can offer insight and assistance with that. But also do your homework. Find out before I had anything injected in me, I'd want to know exactly what it was, where it came from, and what the regulations and the FDA regulations are associated with that. And that's probably the biggest frustration sometimes I have with stem cell procedures is we've kind of gotten ahead of the science and we've gone to marketing, which is tricky because I've seen a lot of patients that have had things done that are one, not helpful, and two, potentially harmful. One patient can, and I've seen that many times. So I just be cautious with patients. Make sure you do your homework. Make sure you understand what's going on, because the more informed you are, the better you're able to make an informed decision with real informed consent. Because there is some challenges out there in this space.
Thank you so much, Dr. Rick O'Bray. I so would love to hear more about this, and especially, did you take your father down there with you?
I haven't yet, but that's on the agenda, and
Okay.
we've had discussions about that.
Wonderful. You've just been listening to Southwest Spine and Pain, Back to Life show with Dr. Rick O'Bray. If you or your loved one is suffering from pain and would like to know more about stem cell, call Southwest Spine and Pain